Okay, so we do our medication administration. First thing, we would have a physical order for a medication to give. We would bring it in the patient's room. We would identify a patient using two identifiers, wristband, having them state their full name, date of birth. Compare the medication ordered on the order to the MARS, pull up our medication. We would do our med calculation for this. This is the potassium chloride. We talk to the patient about any allergic reactions or anything of that. Patient would denies any problems with potassium chloride in the past. So we'll go ahead and explain the procedure and the need for the potassium chloride. The doctor's ordered it, patient agrees to it. Here I have a brand new bag of saline, unopened, unused. I perform hand hygiene upon entering the patient's room. Clean gloves. Go over the 7 rights of medication administration. For right route, right patient, right dose, right time. So, starting out, I've got my unopened saline. I have my calculated potassium chloride. I would go ahead and take an alcohol wipe and clean off the port here for medication administration. Put that in the middle of the port. Be careful not to touch the sides. Put that in, pour out, put my safety on, and dispose that in the sharps. Next I have to make sure that my medication gets well mixed together. Hang it up there. Next, I attach this label that is filled out. Patient name, date, who I am, what medication I put there, what time I did that at. And we'll slap that on the back so that you can still see the original and still calculate how much has drained in to the patient. Put that on there. Next I'll open up my IV tubing. My IV tubing, 15 drips. So open this up. Go ahead and tighten up my roller here. Make sure that I have no kinks. Everything looks okay there. Then open up this. Careful not to touch the sides of it. Yes, go ahead and not to touch the sides, and then I'll go ahead and stick my bag. All the way up there. Okay. And go ahead and squeeze it so it's about halfway full there. And then with this little filter part at the top, I just make sure that it's loose so that the saline can come through. I'll go ahead and open that up. So close that for a second. I have another alcohol wipe here. Open that up. I want to clean off this port here. Got a flush. That would check, and it has patency. I will go ahead and flush it. Observing the site here for any phlebitis or any skin irritation or anything. It flushes well. So I can go ahead and take that off. Break this off the rest of the way. And go ahead and attach that, being careful not to touch the sides. And then I'll open this up. So I've done my med calculation for 31 drops a minute to get my bag to flow in over 8 hours. So I'll go ahead and set my drip rate. We'll pause the video for a second.